Very welcome. So please feel free to continue to introduce yourselves in the top left-hand comments box. Welcome to Anne. So many other people. It's so great to have you here. So we are exactly at the top of the hour, and we will go ahead and get started. Thank you all for introducing yourselves in the comments box. As I mentioned previously, the handouts are available in the bottom left-hand box of the gray handouts area. Should you have questions related to tech issues, please enter them in the tech issues box, the gray box on the bottom left-hand side. If you have questions related to the presentation, Mr. Jackson will do his best to answer them at the end of this session. Please feel free to enter your questions into the questions box. That will help us when we get to the end of the session to go immediately to your questions. This session is being recorded. The recording will be available in 7 to 10 days and can be accessed on the Pacific Southwest MHTTC website. At the conclusion of this webinar, a feedback form will appear on your screen. Please take a few minutes to provide us with your thoughts. This is a really important part of our funding, and most importantly, it helps us to engage in process improvement as we continue to do these sessions. If you have technical issues, again, you can put them in the bottom left-hand box that says tech issues, or you can email Joanne Oshel at joshel@carsrp.org. I am so sorry. I'm going to close this email here so you don't hear the constant dinging sound. So this is, as I mentioned, the third, part 3, self-care of the Compassion Fatigue Resilience series. We are so fortunate to have Mr. Jackson presenting. The presentation is prepared for the Pacific Southwest MHTTC as funded by the Substance Abuse Mental Health Services Administration, otherwise known as SAMHSA. Everything that's about to be shared in here is representative of our presenter and is not necessarily representative of SAMHSA or any other agency. Many of you have seen this map before. This is the Technology Transfer Center map of our nation. We are the Mental Health Technology Transfer Center, Region 9. We're in the bottom left-hand area, that green area that represents California, Nevada, Hawaii, Arizona, and the U.S. jurisdiction of the Pacific Islands. We provide training and technical assistance to the mental health and school mental health workforce of this region. There's also an addictions TTC and a prevention TTC. If you're calling from other parts of the country and you would like to be connected to either the mental health, the addiction, or the prevention TTC, please let us know. We'd be happy to connect you. As mentioned, we provide training and technical assistance to the mental health and school mental health workforce of our region. We are focused on research dissemination that supports the mental health workforce to adopt and effectively implement evidence-based practices. Our goal is to provide evidence-based, culturally appropriate mental health prevention, treatment, and recovery strategies so that providers can strengthen and sustain them effectively. We provide a variety of resources at no cost to the field. The resources include discussion hours. In this particular 6-month period, we're actually having office hours once a month, which are a great place to come in and get some support should you have training or technical assistance questions. We also provide a series of tools and resources which are available on our website. Of course, online courses like this course, as well as regional trainings. We provide individual consultation, affinity group learning, newsletters, and webinars. If you are not currently on our newsletter, please do get signed up via our website. Importantly, the Mental Health Technology Transfer Center Network uses affirming, respectful, and recovery-oriented language in all activities. We strive to use language that is strengths-based and hopeful, that's non-judgmental. It avoids assumptions. We use person-first language that's free of labels, and we strive to be inclusive and accepting of diverse cultures, genders, perspectives, and experiences. It's important for us to be healing-centered and trauma-responsive, as well as resilience-oriented. And we invite all of you, as you participate in the comments box and in the questions box, to also strive to use this affirming, respectful, and recovery-oriented language as well. Without further ado, it is my honor and joy to present to you Mr. Joel Jackson. He is the Assistant Director of Inclusion and Training at the Urban Health Institute and the Diversity, Inclusion, and Equity Department of the University of Chicago Medicine. Many of you might have seen him before on our previous presentations. We are so fortunate to have him with us. Mr. Jackson serves as a subject matter expert for several programs at the Chicago Center for HIV Elimination. Through Truth, Racial Healing, and Transformation of Greater Chicago, Joel serves as a racial healing practitioner. In this role, Joel co-facilitates racial healing circles across Chicagoland, helping to provide space for healing and connection and to reaffirm the humanity in all of us. He is also the University of Chicago Medicine Assistant Director of Inclusion and Training for the Urban Health Institute, Office of Diversity, Inclusion, and Equity. He coordinates the hospital's cultural competence training strategy and is the lead facilitator of the University of Chicago Medicine Cultural Competence course. Joel is also helping to coordinate the hospital's resilience-based care training strategy, which will include a focus on compassion fatigue, resilience, and a focus on trauma-informed care. He is a certified compassion fatigue professional and the 2020 Staff Diversity Leadership Award recipient for the University of Chicago. Thank you very much, Joel, for being with us, and everyone enjoy.
Thank you, Eliana, for that wonderful introduction. And good evening, everyone, and thank you all for attending today's session. Before I get started, if you attended either of the first two or both, you know that I like to tie this information to the professional quality of life scale. So, if you want to access the handout that says ProQual 1 in the handouts box on the left bottom corner of your screen, I'm going to give you 5 minutes to complete the professional quality of life measurement tool, which will help you to assess your level of compassion satisfaction, burnout, and secondary traumatic stress. And then I also reserve about 5 minutes towards the end of the presentation for you to complete the second handout, ProQual 2, which will also include an interpretation of your answers and a scale for you to assess how you were before the session and how you were after the session. And you can also assess how you did in the previous sessions if you were able to attend. So go ahead and take 5 minutes to complete the 30 questions on ProQual 1. And once you're done, just put it down and then raise your hand by clicking on the hand raise button at the top left sort of corner of your screen to let me know when you're finished so that I can move forward with the presentation. So go ahead, you have about 5 minutes starting now. For anyone who has just joined us, we are completing the professional quality of life scale tool currently. You have about 3.5 minutes left if you want to download the handout on ProQual 1. You'll probably need to use a piece of scratch paper to answer, unless you print the tool out and then fill it out that way. Thank you, Wendy, for letting me know that you are done. Thank you, Wendy and Matthew. No rush if you're still working on it. You have about 2.5 more minutes. But if the majority of you get finished before the 2 minutes are done, I'll go ahead and move forward. Thank you, all those who've raised your hand to let me know you're finished. Just bear with us and sit, perhaps, if you can, in respectful silence during this moment while others complete the tool. They have about 1.5 minutes left. Take about 1 more minute. Okay, that was about 5 minutes. If you're still working on it, that's completely okay. Go ahead and complete it at your own pace while I move forward with the presentation. It's for your own edification anyway, and you'll get an opportunity to complete it again, like I said, towards the end of the presentation. All right, so let's go over the agenda real quickly. First, I'm going to share some objectives and go over norms like I like to do. Go over a few definitions just in case we have anyone joining us new today that missed the first 2 weeks. We're going to watch a video on multiple stress factors and social indications of health because it's linked. If you were able to attend some of my presentations on cross-cultural communication, where we kind of looked at implicit bias and think about the racial trauma and the stress that comes with that, all of it is actually linked and has the same kind of physiological effects on our bodies. And then we're going to move right into practicing our resilience techniques. First, starting with self-regulation, practicing a new one today. looking at reframing and exploring some of the symptoms of secondary traumatic stress and how to prevent or manage that by using the tool of reframing. And you'll get to see another video on the concept of of intentionality. And then we'll focus on some self-care practices and techniques, and then end with the ProQual tool questions and answers, and then I'll turn it back over to Ileana for final remarks. Our objectives for today, we're going to define secondary traumatic stress, burnout, and compassion fatigue, describe the negative and positive impacts of our work, and describe and practice techniques for self-care. In terms of our operating agreement, I like to use PRIDE as an acronym to serve as expectations or norms during this presentation. So the P stands for participation. I ask that you do your best to eliminate distractions and stay present on the topics at hand. The R, stands for respect, and I ask that you actively listen, and you can demonstrate that you're listening by participating by using the comments box or the questions box, or answering some of the questions that I have, and you'll have opportunities to answer by using the comments box as well. And also for respect, try to stick with me until the end of the presentation. For I is for integrity, and so I ask that if you hear something that does not vibe very well with you, or if you see something in the comment or question box that does not vibe very well with you, assume good intent. If you can assume the person didn't intend to cause any harm, that can help us with moving forward. D is for diversity, so we want to remain open to learning, even if we hear ideas that are different from our own. And it's also an opportunity for us to use our filters and work on suspending judgment. Judgment is something that we all do. We can't navigate the world without judging differences. At the same time, when we have opportunities like this, we can use our filters and have intentionality about what we type or what we say. And then lastly, the E is for excellence, which I use to express sort of a gentle lean into discomfort. When you're in your comfort zone, there's nothing pressing you to learn anything new. And so through this session, I'll be asking you to participate in some activities, some exercises that you will do on your own to hopefully stretch you from your comfort zone. And the purpose of the norms is to sort of provide a container around the experience so that no one feels fear or threat, and we can all rest at the learning edge. So if I have your commitment to these norms as stated, please show your commitment by raising your hand again in the participants box. Great. It looks like I have about the majority of people, at least that I can see, that agree. If you don't agree, you are more than welcome to decline from attending this session. And if you have anything else you would like to say in terms of disagreement, speak now in the comments box or forever hold your peace. Okay, let's move forward. So, again, the definition of compassion fatigue, or as we think of it as an equation, it is when secondary traumatic stress meets burnout. At the same time, because the symptoms of secondary traumatic stress are very similar to the symptoms of post-traumatic stress disorder or other forms of trauma that we experience, whether that's historical trauma, racial trauma, intergenerational trauma, chronic trauma, acute trauma, system-induced trauma, because the effects physiologically are the same, then as long as you're experiencing any of the symptoms of being in the stress response, that in addition to burnout is what can contribute or cause compassion fatigue. And as you can see, we define burnout as the chronic condition of perceived demands outweighing perceived resources. And so again, burnout is primarily a perceptual problem in terms of how we view the work we're doing or the environment in which we are working in. So, I want to start off by first sharing a personal story around my journey to where I am today as it pertains to this topic of compassion fatigue and compassion fatigue resilience. When I first started working in the healthcare setting, I actually worked in the field of HIV prevention and care. I started off actually as a peer health specialist, reaching out to community members who belong to the same identity groups that I belong to. So I self-disclose, I identify as a gay man, and as you can see, hopefully you perceive me as an African American, a black man, but so I would often do outreach and go into the community and do counseling and testing for HIV and delivering both negative and positive test results. I also helped to lead peer support groups that were focused primarily on prevention, but then also some groups that were for individuals that were infected or affected by HIV for the purposes of engaging them in care and care practices. And so, affected meaning that these were individuals who have members of their immediate family who are infected with HIV. And so when I first got into the field, I felt very energized. I was excited. I was happy to do work within my community and thought that I was going to be able to really have an impact in curbing the numbers of infections and the infection rate, specifically in the community in which I was working. The first person that I tested and ended up having to give a positive test result to happened to be a 13-year-old young man. And as you can probably imagine, that was a traumatic experience for the person. And I experienced, well, I didn't know it then, but after some education, realized that I was experiencing sort of symptoms of secondary traumatic stress from that very first moment. And so if you can imagine continually doing the same work in the community and continually seeing the infection rates rise, HIV prevalence and incidence continuing to increase and not go down, it continued to take a toll on me as I continued to deliver more and more positive test results. I started to experience less joy in the work that I was doing. I started to dread even getting up to go to work each day. I started to operate out of what I call survival stress, meaning I was just doing what I could do to get through the workday so that I could get back to home and really just do nothing but veg out and lay in my bed, because the symptoms of secondary traumatic stress and compassion fatigue were starting to interrupt my personal life in addition to my professional life. In that I started to also experience less joy with my personal relationships. I started to experience intrusive dreams and caused me to lack and lose sleep that I very well needed. I also started to feel like I didn't know how to leave my work at work. I continued to take it home with me in the thoughts that I was having about the different people that I counseled, the patients, and if you're familiar and you know about HIPAA, then there were certain things that I was bound by. So for example, imagine counseling and testing two people that were in a relationship together, but of course not testing them at the same time in the same room, and having one disclose some things to you that the other one did not disclose, and being bound to not being able to even inform the partner about some of the things that the other person's doing because of HIPAA. In addition, I would go into the to different bars and clubs at times where I just wanted to have fun and maybe dance and maybe have a beer or a drink or something like that. And I wasn't able to even do that because the community was so small. I found myself working and playing in the same community. There were times where people would come up to me and tap me on the shoulder just to talk about a question that they have, or their new diagnosis, or things like that. And because I'm not the type of person to say, excuse me, can you contact me between the office hours of 9 to 5 to talk about this, I still made myself available and continued to think that I needed to be approachable even in those situations. So it was hard for me to turn the work off, also because of the community itself, and the fact that the community was so small and we didn't have very many places to congregate and feel complete and whole in terms of who we are and all of our identities. Well, fast forward, after experiencing that for several years, eventually I gained a position working at Barnes Jewish Hospital, which is where I met Dr. J. Eric Gentry, who trained me on compassion fatigue resilience. And the week that I received the training actually was the week of my birthday. Actually, one of the training days was on my birthday, and that's significant to me because I really felt that day I had received a gift. I learned all of a sudden I had a language to name the things that I had been experiencing and going through. Learned all about secondary traumatic stress, burnout, and compassion fatigue. And what's better is I even learned skills that I still use to this day in helping me to manage the stress that I'm experiencing, especially as it relates to the work that I have to do to help me prevent from being burned out and prevent the secondary traumatic stress symptoms that I used to experience so long ago. So I share that story with you really as a model, because if, as you learn these techniques and tactics, you recognize in someone else that they may be experiencing some of these same symptoms, it's helpful to share these tactics and techniques with them after you share your own sort of personal story around issues of compassion fatigue and what you can do for resilience. Okay, so hopefully you were able to listen to the story and know that I shared it simply for the purpose of learning. And thank you for all of the comments that I see. I appreciate the support. So the techniques that we are going to go over, well, these are the first two. We went over self-regulation 2 weeks ago, and we went over reframing last week. And so these are sort of two tools for resilience and becoming resilient to combat compassion fatigue. And we'll explore those before we explore self-care, primarily because unless I'm able to self-regulate, then I won't really be able to reframe or even engage in self-care. And I think that reframing helps me to think about myself in a different manner so that I can better engage in self-care. So it is somewhat comprehensive, where you have to think about how to do these first two techniques while trying to do the third technique. So if you saw this one before, you may remember how I talked about the perception of threat and how it has an impact on our brains in terms of the stress that we experience, because prolonged stress actually changes our brain mechanics. When you look at these sort of SPECT images, you can see that some of the physiological effects of stress impact the brain, where you notice the highlighted areas of the normal brain that has lessened activity of the basal ganglia versus a high anxiety brain where you see all of the highlighted areas, there's increased basal ganglia activity. So this demonstrates how the parts of our brain that trigger our emotions from our painful past or our learned history actually can affect us physiologically. So a little bit more about the stress response or threat response. You could use either one. Research actually shows that this is important. This is an important part of our brain that connects our cortical higher functions with more primitive parts of the brain and plays a critical role in selecting an appropriate response. Much of this research actually is on military personnel who have experienced some form of severe stress, usually from combat. So the anterior cingulate cortex is a part of the brain that is responsible for processing sensory input and modulating appropriate response to it in terms of whether or not we are in danger. So what is interesting about the anterior cingulate cortex is that it appears to be exquisitely sensitive to high levels of stress. High and prolonged levels of circulating stress hormones, like cortisol, for example, or adrenaline, as well as depression and anxiety, cause decrease in physical size, which means it actually atrophies, and decrease the electrical activity. So this is so pronounced that there are some that advocate using the size and activity of the anterior cingulate cortex as a marker for effectiveness of treatment for depression and anxiety, since studies have shown a correlation between decrease in symptoms and an increase in volume and function of the anterior cingulate cortex. So when the anterior cingulate is functioning normally, we perceive threat from our senses. The least bit of stress and it shuts down and we perceive threat from our learned history. So when our anterior cingulate cortex is working well, we collect sensory data about our surroundings for purposes of danger or no danger decisions, like feeling whether we are in a place of harm, actual physical harm or not. But paradoxically, this system does not work as well when the sympathetic nervous system is activated for prolonged periods of time, and when we need it most, it shuts down. So, chronic, prolonged stress from trauma, secondary traumatic stress, or all the different forms of trauma actually impact the anterior cingulate cortex and causes it to shrink over time. And when we need it most, it actually may start to shut down. So, to take this just a little bit further, note in the image that the brain with lightning bolts represents our learned history. So this is what happens in high stress situations. Senses describe only the present moment and are an accurate way to assess danger in your immediate environment. But as humans, we tend to use our learned history, which causes people to anticipate danger that does not actually exist in that moment. It intrudes our perception of the present and makes us perceive or imagine danger that does not really exist, which can really be a form of reality distortion. This concept studied in depth in specialties concerned with high complexity decision making, for example, pilots or air traffic control, military command, and first responders like fire officers or police officers, and including us, those of us who work in healthcare settings and mental health professionals. So research shows that when we engage in a fight or flight, which is fueled by the sympathetic nervous system, we switch from neocortical functioning and processing empiric sensory data and start perceiving threat through learned history data. So the more stressed we are, the more we utilize this mode. So when we're in our fight or flight response, we have our sympathetic dominant nervous system, which causes us to react based off of our learned history, and it makes it hard for us to actually gain that neocortical functioning to help us problem solve and to help us think about consequences of our behavior. So, whatever those experiences in the past were, they continue to color our perception of threat today in our moment-to-moment existence. Humans are incredibly adapted, and actually we are over-adapted. We learn from our experiences and the experiences of others, and we anticipate dangers all the time. So we often keep our bodies in a persistent state of sympathetic dominance, in fact, always feeling like we are always ready for danger. And this is true for me because there are moments where I'm in public and I go to a restaurant and I feel nervous about sitting with my back to the door. Or I think about just random movies that I watch that make me have to think about what is my escape plan. Or if I'm in a building and I start paying attention to the fire safety guidelines or the exits and how I'm supposed to exit a building in case of a fire or an emergency, or when I'm in the hospital and we talk about what we call our code silver when there's an active shooter present in the building. Like all of these things from our learned history are always impacting us and always causing us to feel like we have to be prepared for danger, right? Remember, if you attended session one, I talked about the fact that we are the most frightened and safest generation of all mankind in the history of all mankind. So while feelings are uncomfortable, they are not inherently dangerous. We respond with our nervous system to danger as if we are in danger of immediate bodily harm, but the reality is that 99% of the time we are not in danger. For example, for a few more examples, I may perceive threat as I stand or as I sit here in front of you right now, or when I need to take a break, or when I receive bad news about a patient or a new patient or things like that. I recognize that I am not in immediate danger, but I can still perceive threat because of prior experiences or worry about how I will be perceived or how the patient will respond. So the problem is my nervous system does not understand the difference between real threat and perceived threat. I have the same physiological response to both because of my learned history, and it simply perceives threat and responds appropriately and responds all the time to these sort of threats that are always in the environment. So if you've seen me present before, you know I love a multimedia presentation. So we're going to actually watch another short clip from the Unnatural Causes series, which was published on PBS by a California newsreel. And you're going to hear them talk about multiple stress factors and social indicators of health and how that impacts our bodies physiologically and even contributes to chronic illnesses such as heart disease, for example. So, if you could double click on the button or link below to start the video, and once you are finished watching the video, come back and raise your hand to let me know so that I know to move forward with the presentation. Okay. Looks like the majority of people had a chance to view the video. If you haven't finished, and I'm apologizing for interrupting your viewing of it, come on back to the presentation, and when you get the slides, you'll have an opportunity to look at it even further. Okay? All right, so just to move on, hopefully as you watch that video, it helped you to sort of better understand what I was presenting to you with my sort of didactic presentation, and gave you some imagery to think about how the stress response and how being prolonged releases extra amounts of cortisol and adrenaline and all of those stress hormones that actually then begin to impact our circulatory system, creating more plaque, and also contributes to things like heart disease or stroke or other things like that. So my point is practicing these techniques actually help to better manage the stress, which can actually in turn prolong life, and help us to live a more joyful, pleasant existence and not allow our work to bog us down and cause us to have any of these symptoms. So Viktor Frankl has this quote that says, "That which is to give light must endure burning." And when I think of this quote, especially as I think about it as it relates to healthcare, to me, that means that in an environment in healthcare and mental health or whatever role that you have, we have to somewhat give of ourselves in order to shed light to others. Well, Viktor Frankl himself actually was an Austrian neurologist and psychiatrist, and he was also a Holocaust survivor. He actually lost his entire immediate family in the Holocaust, and he eventually wrote a book titled Man's Search for Meaning, which is about his experiences in the concentration camps and notes on his description of a man's ability to survive even in the most horrible of circumstances. So it is a remarkable perspective in the psychology of survival. Viktor Frankl's assertion that the will to meaning is the basic motivation for human life has forever changed the way we understand our humanity in the face of suffering. He believed that the driving force to human existence is the search to find purpose and meaning to one's life. In one of his many writings, you will find this quote that says, "That which is to give light must endure burning." For healthcare workers to give light, we have to offer solace and comfort to our patients. To mental health professionals, we have to do that as we counsel. And there is a burning because the working of caregiving is very difficult. Even in difficult times, you can still find meaning in your work. So we don't want you to sort of burn yourself up. What we want is to help you find an alternative source of fuel. Some of the greatest wisdom has come from those who experience unspeakable trauma and harm. Holocaust survivor and respected psychiatrist Viktor Frankl, who actually passed in 1997, offered guidance for anyone who suffers. There was a Rabbi Harold Kushner, actually explained in his foreword for Man's Search for Meaning and said that the greatest task for any person is to find meaning in his or her life. Frankl saw three possible sources for meaning: in work, doing something significant; in love, caring for another person; and in courage during difficult times. Suffering in and of itself is meaningless. We give our suffering meaning by the way in which we respond to it. So forces beyond your control can take away everything you possess except one thing: your freedom to choose how you will respond to the situation. You cannot control what happens to you in life, but you can always control what you will feel and do about what happens to you. So, speaking of that, remembering these tools of self-regulation and reframing and approaching this tool of self-care. These are all three of the resilience techniques, and technique 1 and 2 may be relatively new things that you're going to have to practice on an ongoing basis. Technique 3 is actually for symptom lessening, and you will feel better if you have and utilize a support network. Technique 3 is also for sustenance and sustainability or fuel, rather than burning yourself up. And so you have to ask yourself, what do I do from the minute I leave work until I return that gives me bounce and buoyancy? Because the aim is for relaxed joyfulness to be your natural state of being. So, let's practice our professional resiliency skill 1 on self-regulation. Today, we're actually going to practice a simple exercise to help you turn off the stress response in the workplace when you perceive a threat. So another self-regulation method is relaxing the soft palate of your mouth. Because the vagus nerve, which helps to control whether we're in a sympathetic dominance or parasympathetic dominance, actually starts at the roof of your mouth and goes all the way down to the pelvic floor. So, for this exercise, I invite you to close your eyes. And if you're not comfortable closing your eyes, maybe find a focal point 5 to 10 feet in front of you. And if you're seated, try to rest and relax and plant your feet firmly on the ground. If you have a backrest, go ahead and sit back in your seat. What I want you to do is begin paying attention to your breathing. Breathe in slowly through your nose and breathe out through your nose. And pay attention and be mindful as you feel all of the air as it goes in and out as you're breathing. Now, as you're breathing, use your tongue to locate your soft palate at the roof of your mouth, sort of in the back, at the roof of your mouth. Imagine the feeling in that area just before a yawn. That part of the body, that part of your mouth relaxes. Now allow your tongue to rest at the floor of your mouth, because if your tongue is stuck to the roof of your mouth, you're actually experiencing stress. So just let it fall to the floor of your mouth and begin to relax as you're paying attention to your breathing. And relax the soft palate at the roof of your mouth. Remember, this is where the vagal nerve begins, so you're relaxing your vagus nerve. And so what I want you to do is just try to be mindful and relax while you relax the soft palate for 5 seconds. In 5, 4, 3, 2, 1. Think about how you felt before we practiced this self-regulation technique, and think about how you feel now. You may have had intrusive thoughts, which are okay, and perhaps now you're better able to focus and listen to the words that I'm saying as I present to you. And of course, I always like to remind everyone that we can practice self-regulation by practicing the same posture that you see in the images on the screen. So if you lock your hands and you put your hands behind your head, you will actually begin to breathe from your diaphragm, which makes you have to sort of self-regulate, and you move from your sympathetic dominance to more of a parasympathetic dominant nervous system. At any point throughout your day, you can practice these self-regulation techniques, even while you're at work. In fact, I often get very nervous when I have to present and speak in front of people, even in Zoom. So I practice self-regulation all the time. And I encourage you to practice it all day, every 15 minutes, every 30 minutes, every hour on the hour, at least a couple of times throughout your day, so that you're not pushing forward through your threat response. Sorry if you're sleepy. I'll try to keep you excited and awake. So again, self-regulation is the first essential resiliency skill, and you can lower or turn off your perception of stress to minimize symptoms and to become more mindful. So let's practice another activity. This is what we call the silent witness exercise. And we start to think about and explore the effects of our work. So, what I want you to do is I want you to use the comment box, and I want you to type in the comment box 1 to 2 ways you and your team members have been negatively affected by your work as caregivers. Whatever your role is, what are 1 to 2 ways you've been negatively affected, or others in your role that you know of who've been negatively affected? Overworked and underappreciated, lack of funds for program services, experience loss. We feel overwhelmed at students who do not try and continue to fail. Grief over clients, bogged down by paperwork, overworked, overwhelmed by the expectation that as a mental health provider, we can hold space for everyone during this time. Being treated like the low man on the totem pole. Working with apathetic adults. Safety, violence from patients. Feeling ineffective. Guilt for not doing more. Struggling to stop thinking or worrying about clients. Uncertainty. Thank you. All of these are answers, and I see that there are a lot more. It's kind of hard for me to keep up and read through all of them. You know, the idea is as you see some of the things that people are putting in terms of negative effects of our work, that you can begin to see how unfortunately normal it is to have these effects, and you can start to feel less isolated around your experience, because we tend to respond to how people present themselves outwardly and not pay attention to how they perhaps are feeling inwardly. And therefore, we internalize that and then try to present ourselves wearing a mask as if everything is okay, whereas on the inside, we actually are struggling and could be challenging. Okay? So, for example, when someone asks you how you're doing, you know, they don't necessarily always want to hear the truth if you're not doing well. They would prefer you just say you're doing fine so that you can move on through your day. But the reality is, we're not always doing well, and that we sometimes do need support. In fact, one good way of combating the negative aspects or effects of our work is to also think about the next step to this exercise, the positive effects. So again, I invite you to share in the comments box. Please type in the comments box 1 to 2 ways you and your team members have been positively affected by your work or their work as caregivers. So I am closer to my caregiver team for my mother, developed more empathy. Being told that my social work practice made a major difference in a client's ability to get through a very tough time in life. Having a self-reliant team. When people overcome their challenges and reach their goals. Inspired by my students' resilience and success in spite of significant obstacles, changing lives of others. Being able to help students online with distance learning. We are overwhelmed and think of what they want out of us. Uniting together through tough times. Always learning something new. Having a youth whose background and circumstances, when I met him, all pointed to a very difficult future inviting me to his high school graduation. Awesome. When I see people name improvements they see in their lives, when I see people get housed, get a job after years, or reconnect with family despite fractured relationships. When someone thanks you for helping, I try to always help my staff and let them just talk to me when they need it. So these are all very good, very honest, and thank you for sharing also some of the positive aspects of your work. Because when we think about the negative aspects, it's also helpful to think about the positive aspects for the purposes of finding balance. Because although we may experience negative effects, it's possible to still move forward with our work without allowing the negative effects to sort of weigh us down. And I encourage you to maybe even do this activity with teams and team members of the silent witness exercise. You can do it virtually, or if you do it in person, you can do it in person by using actual index cards and having people hold up perhaps their answers of first negative aspects, but then flipping it to positive aspects. So this brings us to thinking about these symptoms of secondary traumatic stress. And the symptoms, as you can see, have pretty much three categories. Intrusive symptoms, so when you suffer secondary traumatic stress, it can be difficult to turn it off. And all of the stressful events are on video rewind in your head. You think about the things not completed, done the way you wanted them, and you feel inadequate. Some of you had those components in your answers in the comments box. There are also avoidance symptoms, thinking about whether or not we should even raise concerns. Avoidance symptoms prevent our staff from engaging with patients. In the case of nurses, therapists, or other direct care staff, might prevent meaningful interactions from occurring with patients. For other staff, secondary traumatic stress may cause us to avoid colleagues and not work effectively as a team. So remember when I talked about dreading coming to work, coming in fact, I would come in late, or I would even not come and not even call and let them know I wasn't coming. Not even afraid that I could possibly lose my job, because that's how impacted I was becoming by the compassion fatigue. Sometimes, because of avoidance symptoms, we eventually begin to engage in self-soothing behaviors. People often use addictive behaviors to cope with secondary traumatic stress. So, for example, overeating, overdrinking, or spending too much money, or even participating in drug usage. And then the third category is arousal symptoms, as you can see, which are constant sympathetic arousal that causes sleeplessness and anxiety. So note that the avoidance and arousal symptoms are identical for those suffering from post-traumatic stress as well. So remember how I said that the symptoms are very similar. So this brings us to, again, this quote. When the pain of staying the same is greater than the fear of change, we will change. Which means that we all have the power to choose when it's time for us to stop doing what we've been doing and change to do something else. So this brings us to the professional resiliency skill number 2 of reframing. So as I've learned more about compassion fatigue resilience, I began to see sort of more of a maturation in my own perceptions, and so perceptual maturation is the ability to move your attention from what is beyond your control to what is in your control. It's about moving from having sort of an external locus of control to more of an internal locus of control. Controlling and thinking more about yourself, your intentions, your responses, and your perceptions, being very intentional about that. And what does it mean if I don't have control? Then I'm then responding to other people and external things that are happening in my environment. So the aim is to have an internal locus of control. So in order to manage stress, it's important to change our perceptions of the conditions in the work experience that typically trigger us to react and perceive a threat. For example, a demand of our manager. That's not necessarily a burden, but it can be an opportunity to do something well if you reframe the way you look at it. Or another example, a complaining or angry patient could be an opportunity to stop and show interest in who the person is and what that person needs. It can be an opportunity to also understand the person even better. So let your perceptions sort of evolve and mature and refrain from this sort of external reactive response to more of an internal control over how you perceive things and how you respond to things. So how do we allow our perceptions to mature? Well, looking at it from all of these different elements, first let's talk about burnout research. Burnout syndrome has subjective and objective components. With the subjective components, the general state of severe fatigue accompanied by loss of self-esteem or physical symptoms of distress without an identifiable organic cause and problems with concentration, irritability, and feeling very negative. On the objective side, it's significant decrease in work performance over several months, observed by patients, observed by supervisors, and observed by colleagues. In terms of professional resiliency, this is the capacity to bounce back after disruption and resist future negative events or outcomes. It's also the capacity that can be learned, and it is like sort of a muscle in that we have to sort of practice at it in order to build it up over time. In terms of positive psychology, Sean Aker actually wrote The Happiness Advantage in 2010. And if you could, please join and share with them. Thank you. There's a resource if you want to click on his TED Talk to learn more about it. It's about 12 minutes and 30 seconds of your time. Play it, not now, but at a future time. And I think you might actually get a lot out of it. But in positive psychology, it brings us to thinking about conventional wisdom, which holds that if we work hard, we will become more successful and then we'll be happy. Recent discoveries in the field of positive psychology show that this formula is actually backwards. The truth is that happiness fuels success. So if we are happy, then we will be successful. When we are positive, our brains become more engaged, creative, motivated, and energetic, as well as resilient and productive at work. This is also in reference to what's called the Tetris Effect. So if you think about the game of Tetris, playing for multiple hours a day creates a side effect, which is dreaming about shapes falling from the sky, even in your waking hours. This is what's called cognitive afterimage. It changes the writing of the brain, and when our brains get stuck in a pattern that focuses on stress, negativity, and failure, we set ourselves up to fail. This principle teaches us how to retain our brains to spot patterns of possibility so we can see and seize opportunity wherever we look. So again, it takes constant practice. So next time that you have a negative perception, really focus on it and try to reframe it to thinking about it in a different light or more of a positive light. In terms of social investment, the most successful people invest in their friends, peers, and family members to propel themselves forward. Our social support network is one of the greatest predictors of success and excellence. In terms of the science of happiness, what makes us happy or what makes people happy? Well, launched in the late 1980s by a physician called by the name of Mihaly, and I can't pronounce the last name, but I can type it in the comments box for you. You can. I wish you luck with trying to pronounce it yourselves. But this individual looked at the psychology of optimal experience and the experience of flow. Flow is when you are completely immersed in an activity with intense focus and creative engagement. So when you're in the zone, you're in your flow, if you will. So have you ever done something that you enjoy so much that you lose track of time? That's an example of flow. And then when it comes to mindfulness, we'll talk a little bit more about mindfulness as we get further into self-care. Thank you, Joanne, for putting the name up. Okay, so now what I'm going to invite you to do is watch another video that actually comes from Barnes-Jewish Hospital. And the image that you see of me in this slide, believe it or not, is about 10 years ago. And this was after, again, Dr. J. Eric Gentry came back and interviewed all of us who were facilitators and asked us about the effects of the compassion, fatigue, resilience work on us. So watch myself and a few of my colleagues back in 2010 talk about the concept of intentionality. So click on the video link, and when you're done watching the video, come back and raise your hand so that I know that I can move forward. Okay, looks like the majority of people are finished. So I wanted to share this video with you because I started off by sharing my story in terms of the impact compassion fatigue has had on me, but I think it's also good to tie the loop so you can see the impact compassion fatigue resilience has also had. And the whole idea about the concept of intentionality is actually a huge part of reframing. Because if I can first practice self-regulation and then reframe and think about my intentions and being intentional about being proactive versus reactive, then I can also use those skills when I begin to engage in self-care and think intentionally about why I'm engaging in self-care for the purposes of refueling, if you will. Which brings us to self-care. So self-care can give us the fuel that we need to endure the burning, because we can't take very good care of others unless we are taking good care of ourselves. So there's a lot of power in being able to be a part of a team on a mission. One of the most powerful techniques for healing anxiety and secondary traumatic stress is by putting it into words and sharing or unloading this narrative with someone safe. It's the same thing that we do when we are helping people heal from post-traumatic stress disorder. We're giving them opportunities to share their stories. This is something that needs to happen periodically throughout our careers, and each of us needs someone to listen to our stories of caregiving, someone who will listen and who understands. So to form connection, it is best to not use a close family member to share our work stories, because our family members are already there sort of to support us, and they may not always understand our work-related or caregiving stories. When you form connections, you are building a community of support. And if there are no formal work times that make it easy to connect, then check in with the person you wish to connect with when worries or concerns seem to overtake you. Also, you can begin thinking about your successes each day and give praise to those you work with. The key is, again, to stay and remain grateful. And also try to take opportunities to debrief. So, for the first activity around self-care, refueling, and accessing support, we call it Dare to Trust, or social self-care. What I want you to do is think of about at least one, but up to 5 different people that you can reach out to that can serve as backup support for you. They could be part of your team. They don't have to be, though, but they should be someone who has a similar role that you have in healthcare. And when you contact them, I want you to think about what you're going to say and how you're going to ask them to be a part of your care network. And keep in mind that this is a reciprocal relationship, meaning that you should also offer to be a part of their care network as well, and that you can also, that the two of you will be there to support each other and listen to each other as you share each other's caregiving stories and provide each other with support. In the handout section, if you download the handout that says Build Your Network, it's something that you can use as a tool later after the session so that you can think strategically and think about who it is that you really would like to ask to serve as your backup support. So the idea is for us to build community, because when you form connections, you're building a community of support. And this is actually sort of like your safety net system. And you can actually take opportunities to check in with each other, share concerns, feelings, and even challenge each other to think and identify one thing that you did for yourself today. And give yourself praise and give each other praise. Maybe think about giving each other positive affirmations, leaving each other post-it notes and saying thank you, and finding opportunities, like I said, to debrief and be one another's care network for support. The idea is to share our caregiving related stories, especially when we're feeling symptomatic or full. Listen to one another, thank each other for listening, and then try not to offer fixes, because the idea is that we're not broken, we're just full and need to unload. Another aspect of self-care is finding personal refueling, or the things that make you happy and that bring you joy. Refueling and caring for yourself, it allows you to have more of a full tank to meet the demands of the day so that you can be in better service to others. So it's also important to think about mindfulness and behavioral challenges when we consider mindfulness as a technique. So note on the slide, you see it says about 40% of thinking is about the future, 50% is about the past, and only 10% is in the present. So I encourage you to sort of expand that time in the present by trying perhaps a few of these examples. You could take what's called a jam or just a moment as you go from patient to patient. You know, how do you walk into the room? How will you enter and be fully present with the person? It really matters how you show up, and patients feel better when you are fully present. You can also practice breathing techniques. Thank you, Joanne, for putting this into the form. Thank you that I look more refreshed, Wendy. You can practice breathing techniques like the breathing ladder. You can try like inhaling for 1 second, holding it for 1 second, then exhaling for 1 second. And you continue it up to for 4 seconds, then you go back to down to 1. So it's like building up the ladder, then coming back down the ladder. And there's a 3-minute breathing space activity that you can access in the second link that Joanne shared. You can also do a body scan and learn how to keep attention focused over a sustained period of time. That is the third, or it could be the last. I think it's the third one that Joanne shared. But just click on all of them and access these. You can also take a moment to check in with your 5 senses. You can just start to pay attention in the present moment to what you hear, to what you smell in the environment, to what you see and observe in your surroundings, noticing colors, shapes, and textures, to what you taste, even if you don't have food in your mouth, just shift your awareness. And touch, skin contact with the chair, feet on the floor, the feeling of the temperature in the room, or when you are caught in a sort of autopilot or stress, touch and contact what's really happening. It actually can allow the change to happen. Some other ideas to increase productivity, you can focus attention on one task at a time. If you get too task focused, then you can get easily frazzled. So know the hazards of multitasking. Multitasking is really serial switching. So try to be more present in each moment and try not to necessarily multitask. And find a place of rest in the middle of things. You know, it's a challenge, but it can be done. You can find rest and relaxation. In addition, you can try staying in the moment. You know, as you see here, it's all about practicing mindfulness by doing your best to stay in the moment. In terms of mindfulness practices for healthcare providers, you can be mindful while hand washing, perhaps for 30 seconds. You can be mindful while eating for 5 to 15 minutes, paying attention to taste, and mindful walking if you do some brisk walking for maybe 1 to 10 minutes. And then in terms of personal self-care, you may want to think of perhaps 3 activities that you can do throughout your workplace and throughout your workday and actually commit to doing them every day. And these activities should be both dynamic or creative, and they should be active, okay? And they don't necessarily have to be things that take a whole lot of time. So like, for example, what you see here, maybe that's calling a partner to hear the words, "I love you," or humming the tune of your favorite song, or perhaps looking at a picture of a family member, friend, or child, or seeing the beauty of something we tend to take for granted, like the leaves on the trees, or breathing, or tasting something good, or going outside to feel the warmth of the sun. So what I will invite you to do is share a brainstorm. What are some self-care practices that you engage in or that you want to consider trying to engage in that you can commit to doing or that you have committed to doing each day. And pay attention to what others share in terms of self-care techniques, because you may want to begin practicing some of these techniques as well. I'm going to give you 1 minute, so go ahead and share in the comment box. What is 1 to 3 self-care techniques that you can engage in that are creative and active? I have a big window too, Lisa. I love the idea of a tech-free lunch. I made my friends do that, going to lunch together when we could at restaurants. Going walking and jogging. I try to get at least 10,000 steps in every day. Snuggling with your kitty. I have a cat too. He's over there resting on his tree right now. But these are all great techniques and tactics, and I encourage you to really commit to practicing them each and every day. So the idea behind self-care, and if you want to, you can download in the handouts box the self-care worksheet, which will give you an opportunity to actually list, different ideas that you may have around these different aspects of self-care. So aerobic activity, perhaps doing aerobics 3 times per week. And this is about, again, replenishing the fuel so that we can endure the burning. You can also think about music, art, or sports that combine discipline and improvisation. You can become more active instead of passive, and you can even find moments to be by yourself in solitude. It's about a spiritual growth and being connected to something bigger than ourselves, like humanity or even nature. It's really about having an intentional plan to engage in self-care. So just one more thing to think about. This is what's called the Healthy Mind Planner, and it's all about making sure that you have a good balance of sleep time, physical time, focus time by yourself, time in when you're perhaps working, also downtime when you're not working, playtime when you're actually just doing something to have fun, and connecting time, engaging in your safety net and your care network. So just want to remind you to take opportunities to nourish yourself. Each time you eat is an opportunity for you to nourish your body. Again, make sure that you're getting adequate sleep and sleep without the TV on perhaps. Take breaks, even if it's for a few seconds. Befriend your body and engage in aerobic activity. Try to slow down your thoughts so that you can be mindful and not have your mind filled. And take opportunities to relax. Also, it's also just about being grateful and finding the beauty in smiling. Some things you may want to practice. You can name 1 new thing you feel grateful for today. Each day, name something new, and I bet you'll find something new each and every day, even if it's just exit ramps on the highway. You could also think of something that has brought you a sense of joy, perhaps something, that made you laugh today. Or think of who do you love that you can reach out to. As I started and talked a lot about Viktor Frankl, I'll end with this quote by him that says, "Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom." And I just wanted to share these with you. I was on the catching the train in the city I live in, and I noticed this billboard on self-care strategies for resilience. And so I actually took a moment and just was walking around the platform because I had some extra time to get my 10,000 steps in, and I noticed this, and so try to take opportunities to notice where you find encouragement, and also think about other resources that you may want to access or share with others, because it's always okay to ask for more help if you feel like you're experiencing clinical symptoms of traumatic stress or post-traumatic stress disorder. And of course, don't forget, It's always great to engage and use the Clara method when you are having dialogues with other people because it helps you to stay in line with your morals and your values. Unfortunately, we don't have a whole lot of time for questions, but if you have any, feel free to put them in the questions box and I'll do my best to answer them. And go ahead and take some time at some point today. You don't have to do it now, actually, because we don't have the time. You can do the professional quality of life tool, the handout Pro Qual number 2, at any point before the end of the night, and then compare your scores that you had before the session as well as the scores after the session. And then lastly, you could please perhaps answer this question in the comment box. What is one action you will take as a result of this webinar? Thank you all for listening and joining the presentation today. Again, my name is Joel. Here's my contact information, and you will also have this if you download the slides. And now I turn it back over to Eliana for some final remarks.
Oh, thank you so much, Mr. Joel Jackson. It is always incredible to participate in your webinars. I am sure that I am not the only one who is feeling a sense of gratitude and calm from having seen your and taking in your presentation. I'm seeing it in the comments box as well. So everyone, please feel free to join us. We've got some important work coming up, continuing on in this idea of self-care and grounding and compassion fatigue. Very related is our Grief Sensitivity Virtual Learning Institute. This is no cost. It is the second part of a series on November 12th and 13th. You can register for it now. You can also access the first part of that learning series on our webinar, on our website, which is where you may also access additional webinars that have happened in the past. And somebody asked earlier in the questions box, Crystal asked whether or not you could access previous trainings. And yes, Joel's 2 previous trainings on compassion fatigue. The first is currently available on our website. The second, which was last week, will be up soon. And this session will also be up very shortly thereafter. For a certificate of completion, this will be automatically emailed to all online participants. If you join through the phone only, please email Joanne Oshel at joshel@cars/rp.org to report your participation. Finally, we have optional continuing education hours for mental health professionals. There is a processing fee of $25. If you would like to access these CEUs, please email Carrie DeSell at Pacific Southwest, one word, Pacific Southwest @mhttcnetwork.org. Finally, please stay in touch with us. Email us, call us, visit our website, and join us on social media. We would love to be in touch with you also through our newsletter. And thank you so much to SAMHSA, our funder. There's information there, and thank you for attending. We do need to hear from you in order to continue bringing you free resources. At the end of this webinar, the evaluation form will arrive on your screen. Please do complete it. Let us know what worked and what we can do better. We are constantly interested in the process improvement. And without further ado, many thanks again to Mr. Joel Jackson for a truly outstanding series of learning about compassion fatigue, and we thank you all so much for participating. Please do join us for future sessions as well. Thank you all.